3-year-old Nelson, who is not getting a sufficient amount of sleep. The daycare center is complaining to Nellie that Nelson constantly wants to nap and all the other young children are actively playing around. Nellie is stressed and worried about her son's sleeping patterns, but she doesn't know what to do.
Hey Nick. Hey, I have an awesome opportunity for you to gain some experience during your clinical. Take a look at this. Tell me what you think. Let me know if you have any questions.
Sounds good.
Nick is questioning how he should address Nellie's situation. He recalls back to the content he learned in school about the therapeutic and non-therapeutic communications that he should use and not use. First, Nick educates himself on the background of Nellie's situation. He establishes the issue, how he will resolve it, and works towards the resolution appropriately.
Okay, so 3-year-old toddler having difficulty sleeping at night. Busy mother has trouble putting him to sleep when it's his bedtime. Mother says it's a constant argument over letting him play with her phone and eating sugary candy before bed every night. How should I address this?
He decides he will do so by using therapeutic techniques such as actively listening, focusing, and asking relevant questions. And he'll refrain from using the non-therapeutic techniques such as automatic responses, asking personal questions, and false reassurance. Nick decides he wants to ask his supervisor, Jared, for some additional information.
Hey Jared, I was wondering if you had some advice for me on how to communicate with the mother of Nelson.
Sure, what seems to be the problem?
Well, I know how to interact with her, but not 100% confident with the issue. You got any tips?
Well, every time I approach a situation, I use the SMART learning objective. First, be specific. Encourage Nellie to be active in Nelson's daily bedtime routine. Promote the use of a journal to make progress measurable. This can be used to track sleeping patterns, what worked well and what did not. Ensure she is setting goals for Nelson to receive proper amounts of sleep every night. These should be attainable. Within 7 to 14 days, Nelson should be actively following a strict bedtime schedule to adopt new behaviors he will become accustomed to. However, remind Nellie that these goals must be realistic. Slowly introducing new habits daily will help the transition Nelson experience much smoother and easier to memorize. Finally, be cautious of time. The promotion of a healthy sleep schedule will be seen within a few weeks. Monitoring progress and rewarding good steps is beneficial.
Wow, Jared, I feel so much more confident now. Thank you for all your help. Hi, Nellie. My name's Nick, and I'm going to be your student nurse today. I heard you're having trouble with Nelson's sleeping patterns. Could you tell me a little bit more about them?
Hey Nick, nice to meet you. Yeah, so I got a call from his daycare center. They tell me that he wants to take naps all the time, whereas all the other kids are running around and full of energy. As a mother, it concerns me.
I see your concern. Can you tell me a little bit more about his bedtime patterns?
Well, I mean, after dinner, I'm exhausted from work and cooking, so sometimes I fall asleep, and I have his older sister, she's 15, look after him. So when it's time for bed, I tell Nelson it's time to go take a bath, but then he just argues with me all the time, demands that he wants to play on the phone. I hate to see him upset or crying, and I usually have a headache after work, so I just give him candy and he's happy. I feel horrible, but, I mean, I just want my son to be happy. He doesn't fall asleep until 11 p.m., which is hours past his bedtime. In the mornings, he's so tired and I have to force him to wake up early because I need to rush him to daycare and I have to go to work myself.
Well,
Nick has demonstrated proper use of therapeutic techniques, such as verbally and non-verbally. Understanding the issue at hand, Nick is debating between the different domains of learning and which one he thinks will be most effective in Nellie's situation. He concludes that Nellie should be using a psychomotor learning approach to adopt healthy sleep patterns with Nelson. Due to his young age, developing a nighttime routine that he must perform every day will make these parts of his day a habit that his body will subconsciously begin to associate with sleep.
during early childhood, sleep habits are established and interventions are more often feasible and effective than those undertaken in life. Helping Nelson sleep more during the night will definitely provide his body with the rest it needs in order to be active in the day. You should set some bedtime routines that can help Nelson perform every night before he goes to bed.
Okay, what kind of routines?
Starting off with restricting his use of your phone and eating sugary candies a few hours before bed is a great start. You could also be more active during his bedtime routine. Try helping him bathe, brush his teeth, or read a story. At such a young age, toddlers do not want to be separated from the parent or miss out on any of the fun activities they feel might be going on. You must be busy with work and everything, so use this to spend time with your boy. Plus, it's clinically proven that there is a positive correlation between a parent-child relationship and the quality and quantity of sleep they receive.
Well, I mean, Nick, that sounds great, but I'm working and stuff. How will I know that this plan is starting to work?
I would suggest keeping a journal of the amount of sleep he receives, the quality of sleep he receives, his patterns, and how he feels in the morning. The progress will be measurable, and this way we can target specific factors that directly influence his sleep. You will begin to see changes within a few weeks once strong habits are formed. Do you have any questions?
No, I think I got it.
Perfect. Don't hesitate to give the clinic a call if you do. There are also various credible websites such as RNAO that can provide you with plenty of reliable advice. In a few weeks, come back for a checkup appointment and we can go over the journal's records to ensure progress is positive. So what are you going to do to ensure the daycare doesn't call you again saying that Nelson is constantly sleeping?
I'm going to keep a daily journal, and then I'm going to track how he sleeps, what causes problems, what works for him, and then I'll come see you in a couple of weeks and we'll talk about it some more.
Great.
Thank you so much, Nick. I think I know what to do with him, and I'll keep the journal. I hope it goes well. Thank you.
Awesome.
Take care.
Nick appropriately addressed the situation and ensured Nellie would obtain the concept properly. He provided her with access to information that was appropriate and had a relation to resolving the topic. He made sure Nellie was comprehending the importance of routine and establishing a strong habit. Nick also evaluated her understanding by using the talkback method. Nellie was able to retell what Nick has instructed her to do, proving she fully understands the concepts learned. Finally, he left a channel of communication between the client by informing her the clinic and assistance is only a phone call away and suggested a follow-up appointment to ensure the issue is resolved.